This diastolic rumbling murmur is typical for mitral stenosis. Notice the increased S1 and loud opening snap that accompany this murmur. In mitral stenosis, the A2 to opening snap interval is related to the severity of obstruction. Patients with severe mitral stenosis often have an A2 to opening snap interval of 80 milliseconds or less. The murmur of mitral stenosis is low-pitched and requires the bell of the stethoscope to be held lightly on the chest wall. Newer electronic stethoscopes make this murmur easier to hear. The murmur of mitral stenosis becomes louder with maneuvers that increase heart rate. An easy way to produce this effect at the bedside is to have the patient perform a few sit-ups. Note the change in this murmur as the heart rate increases. At heart rates above 85 beats per minute, systole and diastole may become equal in duration, and a diastolic murmur like mitral stenosis can be mistaken for a systolic one. Listen to the murmur of mitral stenosis at a heart rate of 85 and notice how easy it is to mistake this for a systolic murmur. I will begin with normal heart sounds and then add the opening snap and then the murmur. Mitral stenosis and mitral regurgitation sometimes occur together, and it can be challenging to detect the diastolic murmur in this setting. Listen to the combined murmurs of mitral stenosis and mitral regurgitation. I will start with S1 and S2, add the opening snap, then the murmur of mitral stenosis, and finally the murmur of mitral regurgitation. With the advent of three-dimensional echocardiography, new details on mitral valve pathology are becoming available. This image shows mitral stenosis from the view of the left atrium. Percutaneous balloon valvuloplasty is an effective treatment for patients with mitral stenosis who have appropriate findings. These findings include commissural fusion of non-calcified pliable leaflets with no atrial thrombus nor significant mitral regurgitation. Listen once again to combine mitral stenosis and regurgitation. In calcific mitral stenosis, both the opening snap and loud first heart sound can be lost due to leaflet immobility, but the murmur remains. Echo-Doppler cardiography remains the best diagnostic test to detect and quantify mitral stenosis. In summary, mitral stenosis, although decreasing in developed countries, remains a continuing challenge in much of the world. Diagnostic and therapeutic advances for patients with this disease have led to successful interventions by cardiologists. Listen once again to combine mitral stenosis and regurgitation.